Departmentalization is the process of dividing an organization into different units based on function, product, geography, customer, or process. It assigns clear roles and responsibilities to improve efficiency, productivity, and accountability. By grouping similar tasks together, departmentalization reduces duplication of work, improves coordination, and improves better decision making. It also promotes specialization, allowing employees to develop expertise, perform better, and feel more satisfied in their roles. Overall, departmentalization enhances communication and cooperation across departments, helping the organization achieve its goals.
Let's talk about the strengths of the Ministry of Health. First, it is the primary healthcare provider in Malaysia. While private services exist, it is only supplementary to the public healthcare, not replacing it altogether. Second, the MOH has enforced a policy in which new medical graduates have to serve a compulsory service of 2 years in public services. This ensures that public facilities are adequately staffed. Third, services are available at free or low cost. This ensures that public services are enjoyed by all levels of income.
However, there are weaknesses. First, bureaucracy is complex because the ministry is very large. Decisions often take a long time. Too many approval steps slow down urgent actions. Second, staff shortage in rural areas. Many doctors and nurses prefer to work in big cities, leaving rural hospitals with fewer staff. Third, coordination challenge between divisions. Different divisions sometimes struggle to work together smoothly, especially during emergency. Fourth, dependence on manual system. Some processes like patient complaints or clinical pathways were managed manually, which cause delay.
For opportunity, Ministry of Health can strengthen specialized departmentalization by specializing departments more specifically based on their core function that can enhance coordination and respond more effectively. Secondly, they can adopt new medical technologies such as digital health system, modern diagnosis equipment, or even automated processes that help reduce waiting times, minimize human error, and support faster and more accurate decision making. They can also create a better coordination between departments to ensure smooth information sharing, reduce duplication of tasks, and improve consistency in decision making.
Third, chronic shortage of healthcare workers and burnout among staff. Shortage lead to burnout, reduced quality of service, and increased wait time for patients. Medical officers often perform double roles with long working hours, clerical duties, and clinical workloads, leading to fatigue and work frustration. Overcrowding in public healthcare facilities. Public health facilities experience heavy patient demand because public care is heavily subsidized, it causing crowding in public healthcare facilities. Number three, lack of funds and insufficient resources. Repeated crises like COVID-19 pandemic highlighted how resources limit can overwhelm the system, with limited funds threaten the service quality and expansion. The last one, unfair distribution of workers' workplace. Doctors and specialists tend to concentrate in cities, leaving rural and remote communities underserved. This geographic gap creates unequal access to care, with rural population often facing delays or travel barriers.
First, the MOH needs to ensure transparency to improve integrity. For example, this can be done by releasing the annual audits of the ministry to the public so it can be examined by third parties like healthcare NGOs to ensure no corruption are done and KPIs are achieved. Second, the MOH needs to separate the management of healthcare from the Public Services Department or the PSD and establish an independent healthcare commission. This is because the PSD sometimes do not understand the depth of health services. Leaving it to the care of health experts will improve the quality of services. The same commission can also regulate private healthcare so that it can be more affordable. Third, the MOH needs to ensure equal distribution of public services. This can be done by building hospitals or clinics in any inadequate areas like rural areas so that public healthcare can be enjoyed by all Malaysians regardless of geographical locations.
To overcome this weakness, we suggest several improvements for bureaucracy. We recommend creating a fast-track approval team so urgent decisions can be made quickly. For staff shortage, we suggest offering housing and allowance package for doctors who work in rural hospitals. For coordination, we propose using one shared online platform where divisions can update information daily. For manual system, we recommend upgrading CISPA into a digital app so patients can track their complaints instantly.
Suggestion to manage the Ministry of Health and Opportunity. Firstly, implement continuous professional development. KKM should provide ongoing training and upskilling program so healthcare staff can perform effectively within specialized departments and support organizational improvement. Secondly, establish clear performance measurement system. KKM should introduce key performance indicators, which is KPIs, to evaluate departmental outcomes, accountability, and overall ministry performance. Lastly, encourage knowledge sharing and best practices. KKM should promote a culture of knowledge sharing through regular meetings, workshops, and reporting system to support, integrate, and improve healthcare delivery.
Suggestion to manage threat in Ministry of Health. The first one, flexible and reasonable work schedules. Ensure improvement of safety and well-being for staff to balance work, rest, and family life. The second one, making a public-private collaboration with public partner with private clinics and hospital to handle overflow cases, especially in crucial condition. The third one, prioritize healthcare budget allocation. With strengthened financial management, it can stable funding to ensure the continuity of service and reduce system strain. The last one, improving work deployment and places to ensure fair workload distribution, allowing healthcare workers to rotate between urban and rural facilities. With that way, it can balance and sustain the healthcare delivery.
Functional departmentalization groups employees by their skills or training, helping them focus on specific tasks. Service departmentalization organizes work by type of service provided, improving service quality, especially in public organizations. Geographical departmentalization divides work by location, making it easier for large organizations to manage different regions. Lastly, customer departmentalization groups activities by customer type, helping organization better understand and meet customer need.